Good afternoon, everyone. At the onset, I would like to thank the organizers for giving me this opportunity. So today's topic is response according to the revised RANO criteria is associated with overall survival in patients with leptomeningeal disease. So around 5 to 10% of solid cancers usually present with leptomeningeal metastasis, and the response evaluation, and they usually have a very dismal prognosis. The response evaluation of leptomeningeal disease is challenging, and there is no or little consensus to it. And also there is lack of standardization for assessing response post-treatment in patients with leptomeningeal disease. So in 2017, RANO et al. Had given the clinical practice guidelines in the ENO-ESMO, in which they had grouped patients with leptomeningeal disease as type 1 and type 2. Type 1 patients are the ones who had positive CSF cytology or positive biopsy, and type 2 were the ones who had clinical findings and neuroimaging only. Further, based on the MRI findings, they had divided the patients as type A, who had linear MRI abnormalities, type B, who had nodular disease only, type C with both linear and nodular disease, and type D, who did not have any MRI abnormalities. Further, they had grouped the patients with leptomeningeal disease at confirmed, probable, possible, or no lack of, there's lack of evidence. This study was validated in 2020 again by RANO et al., in which they had seen that the confirmed, probable, and possible leptomeningeal diseases, as well as the type 1 and type 2, they're significantly associated with the overall survival of the patients. In 2017, Chamberlain et al. Had also proposed a RANO response criteria for assessing the leptomeningeal metastasis post-treatment, in which they had considered neurological examination of the patients, CSF analysis, and complete contrast-enhanced neuroaccess MRI. Based on these findings, they had developed a scorecard. However, the validation of this study was required. So in 2019, RANO et al. Had assessed the feasibility of the previous study, and they explored the feasibility, and they had included 10 neuro-oncologists and 9 neuroradiologists, and the 20 MRIs of 22 patients were evaluated both as baseline and at the follow-up, and they were given RANO scorecard to assess the patients. It was seen that there was quite a lot of inter-observer disagreement, as we can see here, and this was regarding all the items in the scorecard. So they concluded that the scorecard was not useful either for current clinical practice or for any clinical trial. Based on their findings, they further made they proposed a new scorecard in which they had simplified the previous items, and in the brain, they had included nodules, leptomeningeal linear enhancement, and hydrocephalus. And instead of scoring them individually, they had given as improved or no change and worse. And based on this, a new scorecard was given. However, for this also, further validation was required. So in the present abstract, which was presented in the SAPCS 2021, they had evaluated the response according to the revised RANO criteria given by RANO et al. In 2019, and they tried to find if there is any association with overall survival in breast cancer patients with leptomeningeal metastasis. So they included consecutive patients of leptomeningeal metastasis from breast cancer from 2 premier institutes in Italy and France. They included patients who had available baseline brain MRI. Overall survival was defined as the time interval between baseline MRI and death or the last follow-up. So baseline and first available follow-up MRI scans were centrally reviewed by a dedicated radiologist using the 2019 revised scorecard. So they had accrued 225 patients, out of which baseline MRI was available only in 142 patients, and further only 60 patients had available follow-up brain MRI. Coming to the results, only the 60 patients had follow-up brain MRI, and this drop-off was mainly due to either deteriorating performance status or death. At the last follow-up, 138 of the patients out of the 142 patients had died, and the median overall survival was only 5 months. It was seen that presence or absence of a positive CSF cytology did not impact the overall survival, even in the overall patients, nor in the patients who had a follow-up MRI. Between the groups of patients who had follow-up MRI and no follow-up MRI, there was a significant difference in the patients based on the phenotype and HER2, the hormonal status, and also based on the types of the MRI findings based on ESMO leptomeningeal types. It was seen that the patients with follow-up MRI had a significantly longer overall survival than patients with no follow-up MRI, which is quite understandable. And the median overall survival in patients with MRI was 15.2 months versus 2 months only in patients who did not have a follow-up MRI. The only clinical variable associated with overall survival in the subgroup of patients with follow-up MRI was the presence of neurologic symptoms at the diagnosis of the leptomeningeal metastasis. The patients who had a leptomeningeal symptoms of neurologic symptoms at diagnosis had a 14.9 months of survival compared to those who did not have and it was 17 months. So as we can see, based on the scorecards of the 2019 RANO response criteria, there was a significant difference in the survival, with the patients having progressive disease faring the worst, and the better survival was seen with those having complete response. The patients with complete response, as per the 2019 RANO criteria, it was 31.1 months, and those who had a progressive disease had only 9.5 months of survival, median survival. The treatment offered in the group of patients was quite heterogeneous, and on analysis, it was seen only that systemic chemotherapy and hormonal therapy were the only treatment modalities which were significantly associated with better overall survival. So to conclude, it was seen that despite its dismal prognosis, a selected group of patients with leptomeningeal disease, breast cancer related leptomeningeal disease, can achieve a prolonged overall survival. And this study validated the 2019 RANO revised response score, and they further validated and they commented that it can be used in the real world cohort, and they supported the use in clinical trials also. So the take-home message is there is still lack of standardization for assessing response post-treatment in patients with leptomeningeal disease. With improved therapeutic strategies, a certain cohort of patients with leptomeningeal disease can have a better survival outcome. This study validated the revised RANO 2019 scorecard. However, further studies is still warranted in larger cohort of patients.